While we're concerned for ourselves about contracting COVID-19, how concerned should we be about our pets contracting the virus? Here to break it all down for us from the University of Illinois College of Veterinary Medicine is Dr. Will Sander. Thanks for joining us, Dr. Sander.
Thanks for having me. I appreciate it.
Well, absolutely. So I think the big question is, can dogs contract COVID-19?
That is the big question out there. And right now we think there's really very little risk of dogs contracting COVID-19. So there's been a couple dogs that have reported positive in Hong Kong. And those dogs, we think, have a very low level of infection, and they aren't able to spread that virus to other dogs or to people at this point.
So it was 2 dogs in Hong Kong. There was also a cat that I hear also contracted it. So it's dogs and cats that could possibly contract it, but it is unlikely.
It is unlikely right now. And again, this is based on the evidence we have right now. So that certainly could change, but there's been a lot of testing that have been done in several countries around the world so far. And we've had only these 3 positives to date. So 2 dogs and 1 cat. And
how did we even know to test these dogs and cat for COVID-19? Were they showing symptoms, or what made us think, hey, let's see if they have it?
Right, yeah, we're not just willy-nilly testing every dog and cat out there. So we're only testing in these places. It was in Hong Kong and in Belgium. We're only testing those animals that were pets of people who were positive for COVID-19. And so we were looking for the same test that we were in people. We're just doing looking for the fragments of the virus, doing a swab in the mouth and their nose. And for that cat, they were actually looking in the poop sample to try and find out if the virus was there. So
nice.
So yeah, so that's, again, this is why we're only looking at certain pets. And again, in the US, we're not really looking right now for our pets because the risk is considered so low. So even those who are considered positive for COVID-19, we're not overly concerned at this point in testing the pets.
So I know from everything I've learned and heard about the transmission of COVID-19 between humans, from the droplets coming out of your mouth, nose, coughing, sneezing, and all of that. Should we be concerned about, the person that has it coughing, sneezing, and then those droplets getting on your pet and then them transferring to another person via that route?
So that's a great question. And right now, again, the risk is considered really low. So yes, theoretically, if you cough or sneeze and you're positive for COVID-19, you could certainly be putting that on the fur of your beloved companion. And then somebody else who handles that dog or cat fairly shortly thereafter could pick that up. But they've done a lot of looking so far at what surfaces this virus can survive on. And porous surfaces like cardboard or fur, we know that it doesn't survive for very long on those surfaces.
And we talked a little bit about how to test for COVID-19 when it comes to our pets with the swab and the other sample that way. They're working hard to get a vaccine for humans. Will there also be one that is equivalent to our pets?
No, because again, now these 2 dogs and the cat, we haven't actually seen a lot of clinical signs with them. So they aren't really getting sick from this virus at this point. So there's not really a need for a vaccine at this point. So again, we're going to learn more, I think, as the situation develops, like we are with COVID-19 in general. But right now, there's not really much of a risk for our dogs getting clinically sick, so there's not a need to develop a vaccine for them.
And let's talk a little bit about those pet owners who may contract COVID-19. I'm sure they're concerned about the well-being of their pets. Is there anything that we need to, tell caregivers about that? If heaven forbid, the patient has to be admitted to the hospital, anything we should know about that?
Yeah, so I think if you are tested as positive or you think you have symptoms of COVID-19, it's always a good idea, just like you're doing with other people, to try and let somebody else care for your pet. If you have somebody else in your house, that would be great. Or if you have to care for your pet still, just trying to take the usual precautions, washing your hands before and after handling them, feeding them, that sort of thing. Ideally wearing a mask even around the house. Is a good recommendation. And if you have to go to the hospital and have somebody else come and take care of your pet, you should let your local public health office know, because they want to make sure that anybody who comes in to take care of your pet, that we're minimizing any risk, whether that's unlikely from your pet, but potentially going into your house and touching other surfaces that might have the virus on there.
All right, lots of great tips from Dr. Will Sander. Thank you so much for making the time for us here on CI Living.
Thanks for having me.
We'll have all tips on how you can handle COVID-19 when it comes to your pet at CILiving.tv. Thanks again for joining us today, Dr. Sander.